We will discuss sulfonamides, their classification, mechanism of action, their resistance, and their adverse effect. Finally, what is potentiated sulfonamides and what are their combinations? These sulfonamides are the first antimicrobial agents discovered for treating bacterial infections. Domag used prontosil red dye to cure his daughter suffering from the streptococcal septicemia. Later, in 1937, it is discovered that prontosil dye, which is broken down to the sulfonilamide in the body, which is an active compound of the prontosil dye. Now, let us come to the classification of the sulfonamides. These sulfonamides are broad spectrum antibiotics. These are classified as systemically acting and locally acting. Systemically acting are again classified as short acting, intermediate acting, long acting, and ultra long acting. Short acting remain active for less than 12 hours, which include sulfadiazine and sulfamirazine, and intermediate acting, which remain active less than 1 day, and those include sulfamethoxazole and sulfafenazole. And for long acting, which include sulfa-ethoxypyridazine and sulfamethoxypyridazine, which are remain active for less than 2 days, and those drugs which remain active for more than 2 days are called as ultra long acting sulfonamides, which include sulfadoxine. Now let us come to the locally acting sulfonamides, which again classified as gut acting sulfonamides and topically acting sulfonamides. The gut-acting sulfonamides act on the mucous membrane of the GIT, which include succinyl S-thiazole and thiol S-thiazole, and topically acting sulfonamides, which include sulfacetamide and mefenide. Now, let us come to the mechanism of action of these sulfonamides. Bacteria synthesize their own folic acid by utilizing para-aminobenzoic acid, that is PABA. And these sulfonamides are structural analogues or the competitive antagonist of the para-aminobenzoic acid. And these sulfonamides are competitive inhibitors of the dihydropterate synthase enzyme. Union of para-aminobenzoic acid with the pteridine by the action of dihydrofolate synthase, there is the formation of dihydropteric acid. And from the dihydropteric acid, by the action of dihydrofolate synthase, there is the formation of dihydrofolic acid. And this dihydrofolic acid is reduced to tetrahydrofolic acid by the action of dihydrofolate reductase. And this dihydrofolic acid is utilized to synthesize purines, pyrimidines, thereby nucleic acid, which is essential to survival of the bacteria. Now, we all know that these sulfonamides are competitive inhibitor of dihydropterate synthase, and whenever the sulfonamides are introduced in the system, these will inhibit the dihydropterate synthase, thereby preventing the formation of dihydropteric acid. And this action of sulfonamides on the bacteria leads to the bacteriostatic effect. To avoid the escape of bacteria by the action of sulfonamides, these sulfonamides are combined with the diaminopyrimidines such as trimethoprim and ormethoprim. These diaminopyrimidines are capable of inhibiting the dihydrofolate reductase enzyme. And whenever the trimethoprim are introduced in the system, these will inhibit the dihydrofolate reductase enzyme, thereby preventing the formation of tetrahydrofolic acid. Thereby there is no available of tetrahydrofolic acid to synthesis of nucleic acid, and the combination of sulfonamides with that of diaminopyrimidine such as trimethoprim or ormethoprim will give the synergistic effect, that is shifting of bacteriostatic to bactericidal. Let us come to the sulfonamides antagonism. The sulfonamides are antagonized by the presence of more amount of para-aminobenzoic acid and supplementation of vitamin B complexes such as niacin, choline and folic acid. The proteins like gelatin and albumin have capacity to decrease or reduce the ability of the sulfonamides. And now let us come to the bacterial resistance to these sulfonamides. Bacteria get resistance to these sulfonamides by altering the bacterial enzymes that use para-aminobenzoic acid to synthesize their folic acid. By decreasing the permeability of the sulfonamides and by increased production of para-aminobenzoic acid and by utilizing alternate pathway to synthesize folic acid. Now let us come to the absorption rate of these sulfonamides in the different species. Dog is more than cat in pig and cattle. The acetylation is the primary process by which metabolism of these sulfonamides are occur, and the acetylation leads to the decreased solubility, promoting the formation of crystals in the urinary tubule, that is crystallization. The crystallization is because the decreased solubility of sulfonamides in the acidic urine leads to the formation of precipitate in the urinary tubules that will cause the crystalluria. It is prevented by alkalizing the urine, and the toxicity of sulfonamides is less in dog than other species, and this is because the dog lack the acetylation of sulfonamides because of the absence of the enzyme, that is N-acetyl transferase in dog. Now let us come to the adverse effects of the sulfonamides, which include crystalluria, that is formation of crystals in the urinary tubules, and keratoconjunctivitis sicca, that is dry eye, and the hepatic necrosis, hypoprothrombemia, and hypersensitivity reactions or skin reactions. Now let us come to the last topic of this video, that is potentiated sulfonamides. In the mechanism of action, we already learned that the combination of sulfonamides with that of diaminopyrimidines leads to the bactericidal effect, and that is the synergistic effect. The combination of sulfonamides with that of 2,4 diaminopyrimidines such as trimethoprim and ormethoprim gives the potentiated sulfonamides. This is the synergistic effect produced by the combination of these two drugs, and this will lead to the bactericidal effect. Then sulfonamides inhibit the dihydropterate synthase enzyme, while trimethoprim inhibit the dihydrofolate reductase enzyme. The combinations used in the veterinary practice are sulfamethoxazole with trimethoprim. This is called as cotrimoxazole. The sulfonamides are in the ratio of 5 and diaminopyrimidines are in the ratio of 1. The next combination is sulfadiazine and trimethoprim, and this combination is used in treating respiratory infections and urinary tract infections and urogenital infections. And the last combination, that is sulfadimethoxine and or methoprim. This is about the potentiated sulfonamides and their adverse effects, antagonism, their bacterial resistance, mechanism of action, their classification, and the sulfonamides. And this is all about the today's topic. Thank you.